Okay, we're ready to go.
Call this meeting of the COVID-19 Special Committee to order. Madam Clerk, please call the roll.
Alderwoman Davis.
Present.
Alderman Vaccaro.
I'm here, but I think
Alderwoman Hubbard.
Present.
Alderwoman Ingracia.
Present.
Alderwoman Murphy.
Present.
Alderman Coder.
Here.
Alderman Muhammad. Alderman Oldenburg.
Present.
Alderwoman Boyd.
Here.
Alderwoman Middlebrook.
Present.
Alderwoman Clark Hubbard.
Here.
President Reed.
Here.
11 present, you have quorum.
All right. We will hold on excused aldermen until the end of the agenda because Alderman Muhammad may just be running a little bit behind. Approval of the minutes. I'll entertain a motion for approval of the minutes.
I will make a motion. We approve the minutes. I don't know the date. I'm sorry.
Approval of the minutes for June 16th, 2020.
So I move that we approve the minutes of the meeting.
Second.
It's been moved by the Alderman from 23rd, seconded by the Alderman from 13th. Any discussion? Any discussion? It's been moved and seconded. All in favor signify by saying aye.
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 Opposed? Motion carries. Board bills for review. Alderman from the 22nd, recognized on board bill number 90.
Yes, thank you, Mr. President, members of board. Board Bill 90 is an appropriation bill for COVID-19 relief efforts for the city of St. Louis. And I have Mr. Steve Conway, the Chief of Staff at the Mayor's Office, to kind of walk us through the board bill. So if it's okay, I would like to have him introduce himself and talk about the bill.
Mr. Conway, you're recognized for the discussion on board bill number 90.
Officials in Australia continue to try to rescue a pod.
Steve Conway.
Good morning, Mr. President and committee members. Board Bill 90 is a supplemental, basically COVID-19 bill. These were some additional grants that came through to us. I have Charlene Deacon to talk about the two emergency services grant, but I will talk about we had received from the Secretary of State a grant for $150,000, which the election board has already spent the funds with respect to the August primary. We've given them additional funding for the November primary or November general election, but that would be the $150,000 for the local authorities grant program. That was $150,000, allowed them to expand their efforts in August, which I think they did a very, very fine job. They need the funds to restore their budget because they advanced the monies that they spent that they would have otherwise spent under that grant. I have Charlene Deacon. Come on down here, Charlene. If you would tell me about the two grants that you have.
The two grants. Can you hear me?
You got to talk into the machine.
Yes, we can hear you.
The two pots of money that are indicated down the bottom of the first page, starting at the bottom, $180,320, and then the $122,519 is money that was directed to the Fire Department Emergency Medical Service. It was unsolicited, but it's based on a formula, and the rather large number of clients that use the EMS service that are Medicare or Medicaid eligible. So the money as I understand it, is still set aside. The intent of the fire chief with the endorsement of the Director of Public Safety and unofficial permission of the Director of Personnel is to offset, is to actually pay for large amounts of canceled vacation we had. Since all of them were, all forms of leave were canceled in fire and EMS, so that we had the ability to respond to the large number of calls. And to the extent that the overtime expenses are reimbursable under the FEMA Emergency Declarations Grant, I think, the director thinks, the fire chief thinks, that the smartest thing for us to do is to try to bring down some of the accrued leave that we have for emergency responders on the fire side, so that next year, when we start scheduling vacations, we're not driving overtime because everybody needs to be off to use up their time. So that's what that's about, if there are any questions. We haven't proceeded with this because, of course, we can't spend it unless it's appropriated. So there's been no formal request made for this, but we have a large number of fire department uniformed personnel, EMTs, paramedics, firefighters, who had their vacation canceled. And it's on our books. It's on our books. It's a liability.
Okay. Anything further, Alderman, from the 22nd? Anything further before we open it up for questions?
I don't have anything further to add.
Okay. Alderwoman Davis, any questions?
Not at this time, thank you.
Alderman Vaquero, any questions or comments?
No questions.
Alderwoman Hubbard. Alderwoman Tamika Hubbard.
I'm sorry, my mic,
That's all right.
my
Any
mouse
questions?
was acting, my mouse was acting funny. So do they have the specific number of, I guess, vacations that were canceled or number of hours that like we're reimbursing? Did she say that? I'm sorry if I didn't catch it. I was just curious to how they matched the money with what was actually used. Did she mention that specifically?
Sure. I don't know the gross number of hours, but the fire department, kind of like corrections does, and EMS, plan their vacation in advance. So right now, the fire department is scheduling leave, which is a combination of vacation, O days, and comp time accrued, into calendar year 21. So I don't know what the hours are, but the fire chief estimated that this first round, of course, we don't know what's going to happen. There's over $300,000 set aside in this reimbursement. This first round, we think, will cost $160,000 to reduce the amount. There's a limit, and I'm sorry, I don't know exactly what it is. It's 2 or 3 weeks. There's a limit in the compensation ordinance as to how much you can reimburse, and it's subject to approval by the personnel department. But the fire chief's most recent figures would be, it would cost $160,000, roughly half of what's there.
Okay, thank you. No further questions.
All right. Alderwoman Ingracia.
Thank you, Mr. President. Charlene, I apologize. I missed which pool of money you're referencing right now on the exhibit.
Okay, it's starting on line 18.
She's saying on the exhibit.
Oh, here. Okay, it's the EMS CARES Act. There's 2 pots, $122,000 and $181,000. It's really the same reimbursement. It just came to us in 2 different pots. So this is money that the fire department received for emergency medical response, because it's a formula based, and it is based on our rather large number of Medicare and Medicaid clients in EMS.
Okay. And does this money have to be spent by the end of the year?
I don't believe so.
Okay. And what is the remainder going to be used for, the 143,000 that's left over?
Well, I would recommend that we save it in case we need to do this very same thing again.
Okay, and when you have a chance, could you work with the fire chief to get more information? I'm interested in the numbers that Alderwoman from the 5th asked about as well.
Okay, sure.
Thank you so much.
You're welcome.
Righty. Alderwoman Murphy.
No questions. Asked and answered. Thank you.
All right. Alderman Coulter.
No questions.
Alderman Oldenburg.
No questions, Mr. President. Appreciate the succinct presentation.
Thank you. Alderwoman Middlebrook.
I have no questions. Thank you.
All right. Alderwoman Clark Hubbard.
No questions. Thank you.
All right. I don't know if Alderman Muhammad is with us yet. Alderman from the 22nd, you recognize the close.
Mr. President, members of the board, I ask for your most favorable consideration to pass Board Bill 90 out of committee with a due pass recommendation.
I'll entertain a motion for the passage of Board Bill 90 out of committee with a due pass
So
recommendation.
moved.
I'll make that motion.
Point of order.
Alderman from the 6th.
Thanks so much. I apologize. I thought that there was a lot more funding in this board bill than just this one stream that we needed to discuss. Is that not accurate?
Alderman, you're free to ask the Alderman from the 22nd a question, the sponsor.
Thank you. Alderman from the 22nd, did you want to discuss any of the other allocations of funding that are listed out in the board bill?
I did not, but I left it up for the committee to ask questions about any specific pot of fundings that they were interested in.
Okay, I'm curious if the mayor's office wanted to present on any of it.
Is there anything in particular that you want to ask about, or do you just want a presentation on all of the funding?
I'm interested in what the money is going to be.
Okay. Mr. Conway, can you go ahead and explain, wait a minute, I don't want to be out of order. There's a motion.
There was a motion by the Alderman from the 13th and a second by the Alderman from the 23rd. So we have a motion and a second on the floor. We can still discuss before we vote, but we have a motion and a second to pass it out with due pass recommendation.
President, members of the committee, I could withdraw my motion.
No, you don't have to withdraw the motion. There's a motion and a second to adopt it, and I have not put the vote. I have not asked for the vote yet, so we're still in order.
You had plans for this.
So Alderman from the 22nd, if there's any additional stuff that you would like the mayor's office to present, they can.
Had plans for that.
Okay, okay. I just want to make sure I was in order.
You are.
Extend that to the Alderwoman of the 6th. Mr. Conway, can you go ahead and present the rest of the buckets of funding in the board bill that was not previously discussed this morning, please?
Yes. So the one thing that we did receive is what we call ESG COVID-2, or Emergency Services Grant COVID-2. We received an additional allocation of $4.3 million late in June, or whatever the case might be, but in June. This money, these funds have to be spent by September of 2022, and they will supplement our efforts into next year. We haven't obviously appropriated the funds. We have a list of where we have tentatively will go with each of the funds going forward. We have submitted an amended HUD plan through CDA, demonstrating this is the categories that we'll do. And then we will put these out for RFPs. And you've got to remember that when you look at these spreadsheets, we have this year, which is coming to a close in 90 days. And our response to the COVID will be over the next at least 12 to 18 months. We have the doctor here with us today. So you can see the categories that we would spend the additional ESG funds in for the year 2021 and 2022. I'll read them off. It's the Exhibit A, and it starts under ESG COVID-2 plan. It would be administration of $140,000, our HMIS system at $51,000, continued street outreach services of $500,000. We know that as the economy continues to suffer, we'll continue to have to provide emergency shelter services. We have allocated $2 million to that. We'll continue to work on our rapid rehousing. We've allocated $800,000 for that, and we have put in the category of prevention $900,000. And this will carry us through 2021 and 2022. And I can answer any questions, but we're getting ready to put out the RFPs now that we've amended our HUD plan.
All right. Alderman from the 6th, in the future, when I recognize you for questions or anything, just ask that question then, opposed to waiting until we're moving forward with the vote. You know, that way we can, if you have anything else on your mind, you put it out, just give it to us when you have the floor so that we can continue to move with the meeting. Plus, it may open up some things for other people who are asking questions after you. So any further discussions? Any further questions? Alderman from the 5th. Oh, and then Alderman from 27th also. Alderman from the 5th.
Thank you, Mr. President and members of the committee. I don't know if I missed it or not, but have we been receiving any updates on like the different parts of COVID money as far as like with the business owners and stuff like that? Just, I would like an update on the money
that's
that
coming
we've
next.
allocated thus far, how many people were served, or just some more detailed information.
Yes, they are on the agenda to discuss that right after this.
All right,
thank you. Alderman from the 27th.
Yes, Mr. President. My question is, the young lady said they wanted to save the money until they need it. Can we hold that money until we need it, or does it have to be spent by the end of the year?
Alderman from the 22nd, or Alderman, or excuse me, or Mr. Conway, would you guys like to take that question?
I think that Ms. Deacon had indicated that we have so much that will be spent for this year, and most of these, except for the CARES Act fund, run till September of 2020, September of 2021 and September of 2022. She said she's going to verify that amount. I can add a couple of things. We have all of our department heads tracking their overtime that's been COVID related, because FEMA will reimburse some of the initial overtime, and we have an adroit staff putting together that and submitting this to FEMA. So it's a little bit up in the air. We've also asked, because under the CARES Act, I cannot pay for quarantine or overtime unless it's taken. And so we've actually asked, and all of the city employees have been asked to submit their overtime, not to take it as compensation time, but to turn it in so that they can get their cash before the end of the year, so that we can reimburse that this year out of the available funds. There's a couple of parts moving, but Ms. Deacon will get us the specific answer on the final deadline date on that grant.
Okay, and so when they submit their overtime, can they still use their comp time? All employees, not just the fire department.
They can use the comp time they have up, but if I pay them for their comp time, then they don't have it anymore. So if
Okay.
they've earned comp time during the COVID and I paid you for it, you can't carry it over after the end of the year.
Okay, all right, thank you.
All right.
No more
Any-
questions.
All right. Any further discussion? Alderman from the 6th?
Thank you, Mr. President. Steve, one of the last times we met, you indicated that you still weren't sure what the local match was going to be for the FEMA reimbursement. Has that been decided yet at the state level or federal level, wherever that needs to happen?
Well, it's only at the federal level, and we've continued to turn in the funds. I have Nevena here. She has received, we've actually, and she'll add what I have. This is Nevena Chomoff. How many reimbursement requests have we put in?
We submitted, as of last week, we had about 28.
And how much?
Those are like cases. In dollar amounts, as of last week, we submitted about almost 8 million, and have received, by now it's probably $3 million in actual cash.
So we've submitted over $7 million in requests to reimburse various expenses, which comes in at 75%. And we have received cash to date from FEMA, which is a unique, strategy, and that's why we're showing it on our sheets, is that we've received cash for the city reimbursements of up to $3 million as of last week.
Okay, thank you very much.
Any further discussion? Any further discussion on Board Bill 90 before we go to a vote? Alderman from the 22nd, you recognize the close again on Board Bill 90.
Thank you, Mr. President, members of the board. I ask for your most favorable consideration to pass Board Bill 90 out of committee with a due pass recommendation.
It's been moved by the Alderman from the
Second.
It's been moved by the Alderman from the 13th and seconded by the Alderman from the 23rd that we pass Board Bill 90 out of committee with a due pass recommendation. Madam Clerk, please call the roll.
Alderwoman Davis,
Aye.
Alderman Vaccaro,
Aye.
Alderwoman Hubbard,
Aye.
Alderwoman Gracia,
Aye.
Alderwoman Murphy,
Aye.
Alderman Coder,
Aye.
Alderman Muhammad,
Aye.
Alderman Oldenburg,
Aye.
Alderwoman Boyd, Alderwoman Middlebrook,
Aye.
Alderwoman Clark Hubbard,
Aye.
President Reed,
Aye.
Alderwoman Boyd.
Aye.
12 aye votes.
By vote, sustain the motion of Alderman from the 13th and pass Board Bill 90 out of committee with a due pass recommendation. We will dispense with line item 6, line item 7, discussion pursuant to Ordinance 71182. The mayor's office will report to the Coronavirus Special Committee about the city's activities and expenditures of monies from the CARES Act allocated to the city of St. Louis related to coronavirus. Alderman, Mr. Conway, will you be leading those discussions? Because I don't think Alderman Ballmer is here. Mr. Conway?
Thank you. Mr. President, I'll start it off and I'll have the various individuals go through each section. We've sent you 2 spreadsheets just to kind of be a little bit relevant as to what we're looking at, we sent you a very large spreadsheet that just says COVID-19 funds committed or spent. And that is all programs and all reimbursements that we could consider that would be utilized in the mayor's efforts to combat both the health issues, which we've done a very, very good job. I think our average moving cases is down to 24 cases a day in the city of St. Louis. Thank you, Doctor. Thank you, Mayor Cruzen. The other thing is the economic hardships that are coming on our residents here in the city of St. Louis, both the existing hardships today and the ones that we can see coming in the future. On that main spreadsheet that you have, we combined everything to give you the large overview picture. And I'll start off and just kind of give you deadline dates.
All right.
Community development block grant.
Mr. Conway, before you move forward, in the future reports, and I also would like you to update this report, and if you have any of the information that I'm going to request, please provide it to the committee. You know, in accordance with Board Bill 49, these reports are supposed to be a lot more detailed than what we're receiving in these spreadsheets. It's supposed to include, you know, age, race, ethnicity, gender, disability, neighborhood, and other social demographic data related to the spending of the coronavirus money. So if I can just get you to read that section, you know, after this meeting, it's on page 10 of Board Bill 49, and create the future reports in that format so that the committee has all of the information that it's supposed to have when evaluating these reports.
So we have the relevant directors and people available. We will temper how we collect the information depending on what the desires will be of the aldermen today. So with that being said, I have Madison here and the people so that they'll know what the line of questions may or may not be and what the main concerns are. And in some cases, some of the information that you would like is not available.
Okay, I get that, but if we can just have you work on that plan in accordance to the ordinance and in accordance to Board Bill 49, that'd be good. But read it, if you haven't read it, read it after this meeting and then adjust the plans moving forward, and also amend the ones that you've given us thus far, because the spreadsheet by itself does not provide all of the data all of the demographic data that was required under Board Bill 49. But just move forward with your presentation today.
All right. So if you were to look at the large spreadsheet, I just kind of want to make sure that we know the dates. The community development block grant funds have to be spent by September of 2022. The ESG funds across the top have to be spent by September of 22. Everybody knows the CARES Act funds have to be spent by 12/31/20, at the end of this year. So we've sent you a separate sheet on the CARES Act funds that have been spent or committed to date so that you can see we've made better headway than most people in this country in addressing our human needs here in the city of St. Louis. The FEMA column is just a column that we've created so that we can begin to track what we can submit to FEMA and what we're getting in the way of reimbursements. That would be the overall spreadsheet. Dr. Eccles is with us. The Department of Health and Human Services is at the forefront of addressing the COVID, and he will go through his items with you right now as of the status and expound on any of the explanations.
Okay.
Dr. Eccles?
Good morning to all board members, and Mayor's Office representatives. the City of St. Louis Department of Health has significant allocations for COVID-19. Over the past few months, we've been working diligently with our stakeholders and community partners to execute contracts to address some of the gaps that were identified during the COVID-19 response. Other priorities that were identified, one was an infectious disease response plan, which is the purpose of this was to revise the city's infectious disease response and prevention plan. However, after having further discussion with the FEMA director, with the City Emergency Management Association, they felt like the plan that was already in place was sufficient, so we'll be repurposing the $100,000 to address other needs. For increasing staff capacity for the public health representatives, we allocated $750,000 for this year for bringing on additional contact tracers or disease investigators. And so there was some delays because of the process. There was some delays in bringing those staff on board. However, we have hired staff and continue to hire staff to assist with disease investigation and contact tracing efforts. So right now we are estimating about $400,000 of the $750,000 that were allocated for increasing staff capacity for the health department that will not be used because we didn't have a full year. So we started the discussions for the board bill didn't get approved until after July, and so that because in the hiring delays, just bringing people on board, so we won't be spending down that the full allocation. So we'll be repurposing roughly $400,000 of the funds allocated for increasing staff capacity.
How many people have we hired?
So far, we've hired 13 disease investigators. We continue to receive support from the Missouri Department of Health and Senior Services for disease investigation and contact tracing efforts. For enhancing IT capacity, there's another area that the health department was looking to address by procuring a updated web surveillance or epidemiology surveillance program. However, the State Department procured a platform for all health departments across the state of Missouri, and so those funds won't be needed. So we'll be reallocating those funds as well because the state procured the surveillance platforms that were needed. And so right now, the state is has been providing training to all the local public health associations or agencies across the state of Missouri to make sure they can properly adapt to the new surveillance platform that will be used for COVID-19 surveillance activities. For enhancing public health communication capacity, we allocated $200,000. That $200,000 is accounted for, and so there will be no funds left over for communications. For COVID-19 testing supplies, we allocated $875,000. All those funds are currently accounted for. We also allocated $1.5 million for early child care support, PPE, and training, and those funds are accounted for and have been spent.
Doctor, if I can interrupt you, on that 1.5, we have sent you this sheet of the 1.5 million that went to the daycare centers. And on page 7, it lists every neighborhood that the daycare centers are located and how much each neighborhood's daycare centers receive. So that should have been in your package of information.
And then the final project is expanding telehealth bandwidth for federally qualified health centers. And we felt that this was really a huge priority because a lot of the individuals who have underlying medical conditions and are at greater risk for COVID-19 may have issues actually getting to their medical provider's office. And so early on during the COVID-19 pandemic, the landscape for medical service delivery really shifted to telehealth services. However, because this is something that hadn't been invested in a lot by the federally qualified health centers, we feel like this is a time where we can help them increase their capacity to deliver telehealth services, particularly for our most vulnerable populations. And so the $875,000 will go to assist 3 health centers in the city of St. Louis. It was offered to all, but only 3 opted to take advantage of this opportunity. And so Affinia Healthcare, Casa de Salud, and Betty Jean Kerr People's Health Centers will be receiving roughly $290,000 each to enhance their telehealth capacity to provide medical services and support for our most vulnerable population.
Language. I think you can answer him.
And overall, for the testing capacity, the city of St. Louis, as you all are aware, was the first city in the state of Missouri that removed all barriers for COVID-19 testing. So we removed all financial requirements, insurance requirements, so individuals across the city could access COVID-19 testing. And so that is still in place now through our federally qualified health centers. And according to the data, we've tested over 100,000 individuals across the city of St. Louis for COVID-19.
And then, Mr. President, do you want to, however you want to do this, since the doctor is one subject matter, do you want to allow the committee members to ask him questions?
Yes, we'll go through questions for each one. All right. So, second here. Alderwoman Davis, any questions?
Okay. The only question I have is when you mentioned the demographics, I wanted to ask Dr. Eccles, in the long version of this, all of the data that you are collecting is not only for the reporting and substantiating how the funds were spent, but you're also going to be using that data for future references for any other types of serious issues we have, knowing where the vulnerable populations are and what they may look like. So you're going to store this for a long time.
Yes, to your point, so we use the data that we collect not only for policy, to inform our policies, but we also use it to inform the initiatives that are developed by the health department. As we all know, a lot of the health inequities that we are seeing with COVID-19 are not new. These are pre-existing. They've just been exacerbated by the COVID-19 pandemic. And so one of the things that the health department is doing is working across the system to make sure that we have a structure in place to properly address these issues that we identify year in and year out. In addition to that, we also will be working with some academic institutions to obtain a better understanding of the impact of COVID-19 and the mitigation strategies that have been implemented to slow the spread of COVID-19 amongst our population, especially our most vulnerable population. And this will be a qualitative assessment that will be utilized to assist in addressing, again, addressing those gaps that we talk about, but also to give us a better platform so that when we're developing policies that address racial and health inequities, we'll be doing so using data that's provided by the community at large.
Thank you very much. That was my only question.
All right. Alderman Vaccaro.
Just listening, I have no questions.
Alderwoman Hubbard.
No questions. I would just like to concur with you, Mr. President, on us getting those detailed demographics just regarding all of the COVID efforts, especially in reference to Black-owned businesses, like the $5,000 that was allocated to each business. I would like to know how many Black-owned businesses received that funding, and as well as what my colleague from the 19th said, that I would like to see how the data that's derived from all of the information that you all are going to provide, how we're going to use that data to move forward in further allocating resources throughout the community. That's all I have. Thank you.
Thank you. Alderwoman Ingracia.
Thank you, Mr. President. Dr. Eccles, can you speak to or provide information after this on where the $875,000 in testing supplies went, if you have that information?
Sure. So the $875,000 for testing supplies went to when we procured COVID-19 testing kits as well as PPE which is needed by the FQHCs to properly protect their staff while providing that service to the community at large. I don't have the details with me, but we can make sure that that information is provided during the upcoming meeting.
Okay, so all the money went to FQHCs?
No, so I think there are two things. So COVID-19 testing supplies includes the purchase of COVID-19 test kits, as well as PPE that are needed for the FQHCs to properly test individuals for COVID-19. So other PPE gowns, face shields, face masks, all those other supplies that are needed to actually safely conduct COVID-19 testing. So that's on the COVID-19 testing supplies. And then for yes, hopefully that answered your question.
Yep, thank you. And then is there money left over that still needs to be spent since only 3 of the FQHCs took advantage of the expansion of bandwidth? Or is all the money allocated? I apologize. I may have missed that you covered that.
So for the telehealth improvement project, all the monies are accounted for.
Okay, great. Thank you so much.
All right. Alderwoman Murphy.
Yeah, just one question, just to clarify. So my understanding is that all the money that's been awarded to the daycares or the small businesses, they're all application driven. In other words, they had to individually apply for everything.
Okay, so 2 things. I have Will here, and I have Rob Orr on the phone. So when we get to the business, but it is all application driven because all the funding that we have to put out has to comply with all of the federal guidelines and reporting requirements and documentation that we've spent it correctly. So in both cases, the daycare centers made applications and all of the businesses made applications. And I do have a map in your package of all of the businesses. And again, on page 7 of the Mental Health Board presentation package that's in your package, list all of the neighborhoods of the funding and the status of the funding in each case.
Thank you. Thank you. That's what I thought.
All right. Anything further, Alderwoman?
No, thank you. I'm sorry.
Alderman from the 7th.
No questions.
Alderman Cole. Alderman Muhammad. Alderman Muhammad. Alderman Oldenburg.
No questions. Thank you, Mr. President.
Alderwoman Boyd.
No questions, Mr. President.
All right, Alderwoman Middlebrook.
No questions, Mr. President. Thank you.
All right, Alderwoman Clark Hubbard.
No questions. Thank you.
All right. Any further questions of the doctor before we move forward? Any further questions? All right, Mr. Conway, please move forward with the next presentation.
Okay, the next section will be the funds associated with, I'm going to go skip down to CDA for a minute. Valerie Russell is working the transition of the Biddle House today. She should be here after a little bit when she finishes working through the transition. So I'm going to go down to the CDA funds on the list, and that will be Matt Moak. And the first item on his list, he can explain it. I have Rob Orr on the phone. We also have a map in your package, Alderwoman from the 5th, of docs for every business as of last Friday that had received the small business grant. And you can see that it's throughout the city of St. Louis. I think over 53% of the funds were spent, and sorry about that, in the priority areas in the city. And we'll have Rob Orr and Matt explain that to you. Matt Moak.
Good afternoon, Mr. President, distinguished members of the committee. Referencing Exhibit A here, you see at the top of the CDA line, Small Business Support, SLDC, which we've already talked about quite a bit here today. This is CARES money. So obviously, and I'm going to come back to this a lot today as I talk, the need to get CARES money out the door by the end of the year has become paramount for CDA as well as everyone else in this room, I'm sure. And that's certainly true for small business, although I will say, and I think Rob Orr will echo, that it wasn't a problem getting $4 million out the door for small business. Matter of fact, we're running quite close to being completely expended in that regard. Mr. Conway referenced the map in your materials. I'm not sure exactly where that, I think you said page 7.
No, page 7 is the.
Oh, okay, I
This is a
misspoke.
standalone map.
There's a map of the awards, and I know, yeah, Naveen, I think you have that, and maybe you could display that for the committee.
Mr. President, we're going to put the map up just for 1 second.
Okay.
Okay, you scroll the map. Goes from the bottom to the top of the city. Bottom half. Keep going. Go the other way. Go up. There you go. Keep going. All right, that's good.
So you can see there that, you know, the detail ward by neighborhood, by promise zone, by the neighborhood revitalization strategy areas, which is a HUD-determined parts of the city. I'm sure you're all familiar with the NARCIS. Rob, if you're on, I mean, I have some basic detail that I'd like to share with the committee. I understand that there's been $3.23 million of the $4 million CARES allocation that has been funded for 646 grants, and there are 154 grants left to be funded with the 770,000 remaining in the program. But you also received a total of 1,449 applications.
Yes, and to that, and you will receive a letter from me today requesting another $1 million be moved to help these small businesses. But the other part that I don't see on here, and I appreciated the map, but it doesn't, I didn't see the percentage of minority-owned, women-owned businesses, that kind of demographic data. I see the locations, but beyond that, and whether they're in the promise zone or not, but whether they were minority-owned, women-owned businesses, various different pieces of information like that would be helpful.
Hey, Rob, are you on? I know I saw him earlier.
If STL St. Louis, Rob Orr is on, I believe his application would have gathered that.
Yes.
Okay.
So we did. Stand that up a little bit so I can see the other part of the map.
Scroll down.
Can you hear me?
Yes,
Yes,
Rob.
yes, we can hear you.
Thank you, Mr. Moak, Mr. Conway, and Mr. President. We actually were advised by legal counsel of the city not to ask some of those types of questions that you may be asking right now, Mr. President. We can maybe go back and do so afterwards. We were told that we could target certain geographies, but that we couldn't, you know, the implication that if you ask for minority ownership, it may be used either for or against a particular applicant. And our grant committee was not wanting to do that. We wanted to make this basically a cut and dried process whereby a grant applicant that meets all of the criteria that was established and was current with their business license and payments and reports due to the Collector of Revenue's office would be eligible. And that the only decision.
Hey, Rob, we wouldn't, I don't think we'd have to ask that information. I think we would know based on the information that the city already has, whether it's minority or women-owned business or not, wouldn't we? For most of them?
Well,
for some of them at least.
Possibly. I do know, and I'm not sure what information the license collector, we're not privy to all of their data in their system.
Okay.
So I can't answer that completely. I do know that, you know, for example, those businesses that would register with the MWBE program with the city of St. Louis, typically these small businesses would have no benefit to do so. So a small minority.
Like restaurant or something like that, yeah.
Exactly.
Yeah.
So there's no benefit to them to register. So, you know, we have I think we probably do have some that, smaller contractors maybe that are within that program, and we can certainly look into that. But we were suggested that we focus on these underserved neighborhoods and geographies and award more than half of the grants to businesses that meet those, that are within those geographies.
Okay.
So my numbers differ slightly. I think this map that you're looking at is, I think we're actually up to 750, and you'll notice that the totals in each of the sections don't add up. So this map has been updated as of last Friday, and we can certainly share that with you. But we have approved 750. There's a few of them that are on hold because of issues that arose after approving the grants. But we have funded, my math is 687 have been funded as of yesterday morning, which is $3.435 million. We are trying to wrap up this program by the end of this month with our first round, and we appreciate the opportunity to help additional businesses if additional funds are provided. We believe that there were roughly 10,000 businesses that we thought were eligible from this program. And based on the criteria we established and based on data that we received from the license collector's office in March of this year and also in May, we received 1,465 applications. We think about 213 of those were duplicate applications where someone who was filling out the online application maybe weren't sure that their application went through and that we got it, so they went ahead and did it again 2 or 3 more times. That number also includes businesses, a business owner who may own multiple businesses, a restaurant, a couple of restaurateurs, for example, applied for multiple businesses of theirs, and we were only awarding 1 grant per business owner or ownership group in order to help them as many different businesses as possible. So we probably had a little over 1,250-ish unique applications. The majority of these our struggle is we're still dealing with, somewhat of a paper-based CBI clearance process through the license collector and the collector of revenues office. And we're finding that only about 1/3 of the businesses are passing both clearances on the first try. And so what we've been doing is working with some of those businesses to clear up their unresolved issues. And frequently it's an earnings tax report that's due for a previous period or an annual report due at the end of last year. In other cases, it's unpaid personal property taxes, which I think some of the business owners didn't realize the collector of revenue would also be looking into those issues. And so we've done our best and are really have a great team that's working to try and help those businesses get current with the city. We certainly didn't want to provide a grant to a business that owes the city significant sums of money and then wouldn't be able to use that money to pay off the city and would use it for other purposes. So we've been very mindful of that approach. If we did receive some additional funding, we do believe that all of those businesses that applied in this round that meet all of the criteria, even if it means holding their hands and helping them get to the final, to the finish line, can be funded. We think we could go a little over the 800 that we can do with the $4 million allocation and approve all of those, because again, some of those businesses just will not be able to clear up their issues. So the additional funds, then we would go out for a new round of grant applications. We might modify the criteria slightly. We'd certainly like to try and find a way to be more efficient and get these monies funded much quicker. As Matt said, we have until the end of the year to get these monies out. But if we were going to do an additional round, we think we could do so very quickly given the numbers that applied for this grant. And I would entertain any further questions.
Rob, how many applications do you think are left to fund, and how much would that be if we actually fund everyone that had sent in that qualified?
So I think that number, we've just sent out another round of clearance requests to the license collector and collector of revenue. Again, we've been getting back that roughly 1/3 of them are good to go right away. And of the 2/3 that aren't, a number of those, but not half, but it's a percentage of those are able to clear up those issues. So my estimate is that we could fund 825 to 850 if we had the sufficient funds of all of those applicants who meet all of the original criteria. And so that would mean an extra 125,000 to 250,000 allocation over and above the 400 or above the 4 million. And if we were awarded or allocated an additional 1 million, what we don't need to fund all of those grants that applied in the original round would allow us to do an additional 150 to 180 additional grants at the $5,000 rate. And so we think that we can probably get those out within 8 to 10 weeks.
Okay. Mr. Conway, if there isn't anything further on this one, I'd like to open up some questions for Rob while he's here.
That's good, whatever you'd like, Mr. President.
All right. All right. Alderwoman Davis.
Thank you very much for giving us the additional details. One of the things that I have been concerned about, because I did go out of my way to reach a lot of small businesses, many of them were in jeopardy with a number of issues with tax problems and things like that, so they couldn't apply. But in the meantime, I want to see us do a little extra work in setting up some payment plans for people and giving them an opportunity to be in good standing. And if we would do that, if we had done that earlier, probably some of them would have found a way to get things cleared up so that they could be eligible. So let's just make sure that we put all our extra efforts in place. And it's not a question, it's just a suggestion. Thank you.
All right. Thank you, Alderwoman Davis. That's a very, very good point. Alderman from the 23rd, Alderman Vaquero. Vaquero De Niro, are you there? So we'll come back to Alderman Vaquero. Alderwoman Hubbard.
Thank you, Mr. President, members of the board, and thank you, Mr. Ward, too, for offering us this detailed information. I know I called you personally about a few businesses that weren't even in my ward, but that people were just concerned about the process and what that process entailed. I just would like to see, I guess, the updated list so I could understand it more, because when you look at the map or the data that you provided, it was like 53 businesses in the 5th ward received it, but then when you look at the neighborhood breakdown, 48 were in downtown West. I'm wondering, it was a portion of those, what portion was 19, what portion was 5, and then when you look at like St. Louis Place and Car Square is like only one business. So I for my information, I would just like to know that the bulk of the businesses receive funding in downtown West opposed to other areas within the ward. So if you all could provide us that information, I definitely would like to see it and like to see why, so that maybe I could offer some additional support or resources to those businesses throughout the entire ward that applied and didn't get funding, or if it's a situation where they had some tax issues, just to see how moving forward, how we could assist them during a trying time, because it's a blessing for many of them to still have their doors open. So that's what I'm concerned about. And if you could offer us any additional information so that we could help the business owners, then I'd appreciate that. And that's all I have. Thank you.
All right. Thank you, Alderwoman Hubbard. Alderwoman Ingracia.
Thank you, Mr. President. Rob, I've got just 2 quick questions for you. The Missouri Department of Economic Development had a grant program also that is now closed, and then we know under CARES, the funding mechanisms that were available to businesses. Is any entity tracking, or is there any strategy around who's getting access to what? And I guess just some sort of strategy or thought process behind allocation of money to make sure we're helping as many people as possible with the monies that are available at the local, state, and federal level.
Well, I would suggest that there's, and thank you for the question, Alderwoman. I think that there was certainly no real coordination due to the, the urgency of trying to get these monies out by coordinating with the state. When we rolled this program out initially, we did suggest that, and it really was an honor system only, that a business that did receive PPP or EIDL through the SBA would not be eligible. And we found that this was an unpopular decision for a number of reasons. And one of those being that a lot of the PPP loans that were provided by SBA were relatively small loans. And they didn't really, maybe assist sufficiently with businesses and their needs during this time. So after the first few weeks of having that as a requirement, we did remove that requirement. I think it was on July 1st. And that was helpful in getting us another 500 or 600 applications within the next couple of weeks. As you may know, my understanding is that, the CARES Act funding on the national level isn't even being well tracked for, $250 million types of loans, let alone getting down to, this micro level where we're assisting businesses. One of the decisions we made early on also was that, to keep the businesses, help as many different businesses as possible, make it a flat $5,000 grant to all businesses. So we could do 800 versus doing some sort of a scaled grant where maybe some slightly larger but still small businesses could get 10,000 or 15,000. We figured that it was urgent to help as many of these businesses as possible and try and keep the process going as efficiently as we can. So I don't know, I do know that we directed a lot of businesses that were not eligible for this program to the Missouri's Department of Economic Development's program. We do know that a number of people applied through that program because a lot of them reached back out to us and asked us, what the status of their application was. And we know that, they were actually applying at the state level and were confusing our role, in that program.
Okay, great. And then is SLDC undertaking any advocacy with the state legislature or governor or Congress right now with respect to, it would be great at the local level to get some more money infused, but again, the state has received quite a bit of money under the CARES Act that it's sitting on and isn't allocating at all. So I'm just wondering if you're having conversations in that regard. And then since Congress is back debating, their next relief package, I'm just wondering what your thoughts are on obtaining additional assistance at those two levels.
So we certainly have lobbyists that, are advocating on behalf of the city of St. Louis. I believe it's hired through the Port Authority, but I would suggest that the mayor's office would be in a better position to respond to what those efforts might be on the national level. SLDC is not directly advocating, but we do get on a call every other week, was every week for a while, with all of our regional partners and our state partners, and we certainly have brought it to their attention. DED is represented on those calls, that we would like to find, more resources to help small businesses. So in that maybe more informal kind of situation, we have certainly been advocating on behalf of finding additional resources for small businesses.
Great, thanks for your time. I appreciate all your work.
My pleasure.
All right, Alderwoman Murphy.
Yeah, just one question. I may have missed this. Do we have access to the businesses that actually applied in our ward and those that were accepted? I see the dots and I see all that. Do we actually have access to the information who applied and then who received or didn't receive the loan?
So thank you for that question. Yes, the answer is we certainly can provide that. Our goal was to not provide that until we have funded all of the grants that we could fund so that it didn't become a political issue. But, as to Alderwoman Hubbard's question a little bit ago, we will provide a more of a breakdown as to where these applications came from and where the grants were awarded. And one of the things that we found, we also rolled out 135 small business loans from non-CARES Act funding previously to this grant program. And what we found is that, across the board, the percentages of businesses that applied in each of the various geographies, whether it's ward, neighborhood, opportunity zone, those types of things, almost identically matched the percentage of what was awarded. So if there were, 5% of the applications coming from a ward, they typically in the loan program, they got 5% of the loans. So we generally process these in the order received, and the only time we get a little bit out of order is when we have to work with the businesses to clear up some of their collective revenue issues. But we're taking them on a first come, first served basis, but also being mindful of that target of 50% or more of those loans or grants being needing to be awarded in those underserved areas. So
Okay.
we are certainly mindful of that. And when we get to the end of this, funding the 800, or if it's slightly more than that, based on what we get, I think we'll find similar that, it's based on a percentage of businesses that apply within each of the geographies. We're not picking and choosing. We're
Right.
taking them in order as received.
Okay. Thank you very much.
My pleasure.
Thank you. Alderman Coder. Alderman Coder. Okay.
No questions right now.
All right, Alderman Muhammad. Alderman Muhammad. Alderman Oldenburg. Alderman Oldenburg. Alderwoman Boyd.
Thank you, Mr. President. First, I want to thank Rob Orr and Daphne Moore, because you all have went above and beyond to work with these businesses, especially in my ward, because I have some businesses that had some issues, but you all kind of educated them. And I think that's the magic word. They were educated and they were assisted in getting their business in order so they could even apply and acquire those grants. So that was a big help to businesses in my ward, because I think what the challenge has been, a lot of people weren't knowledgeable on the processes and what should be happening in their businesses as far as handling what's correct. And that's what the earnings, and that's with the taxes. And so a lot of them would call me and say, well, they didn't give me the money. And then you all kind of educated me on what questions to ask. And when I asked those questions, then Daphne and yourself would always step up to kind of help them. So thank you. I just hope that we continue to keep working with these businesses, because it helps them as business owners, and then it helps the city as a whole. So I didn't have any questions. I just wanted to publicly thank you all for stepping up to help them, because a lot of our people in our wards are intimidated when it comes to government. And so they figure that they're not going to get help, or they're going to get penalized or punished. And so working with you all and working with Greg Daly's office and Mavis Thompson's office, you all came as a team effort to help those businesses get on the right track and build themselves up. So thank you very much.
Thank you for that.
Thank you, Alderman Boyd. Alderwoman Middlebrook.
I have no questions. Thank you.
All right, Alderwoman Clark Hubbard.
No questions. Thank you.
All right, thank you. Mr. Conway, thank you, Rob, and thank you guys for all your work. I really appreciate it.
Mr. President, I'm going to just deviate. Charlene Deacon has an interview she has to do. She's going to drop down and pick up a couple of these small public safety ones that weren't part of CARES, but on the spreadsheet.
Okay.
Is that okay?
Yes, please proceed.
Can you hear me from here?
Come on down here, Charlene.
Yes, we can hear you.
All right, well, I'm getting up anyway. So if you skip down to item number 4 on the spreadsheet, there is a not quite $1.4 million appropriation that we received as an allocation supplemental to the 2019 Edward Byrd Memorial Justice Assistance Grant. The nature of this allocation was to prepare us to respond to the COVID pandemic in these particular areas. As you well know, the JAG requirements are pretty rigid as to what you can use them for, and so we submitted an application for these 3 areas: police, EMS, fire, and corrections. And every single item, as you know, when we have to be really specific, detailed, unit cost, everything for these grant applications, are for public health and safety equipment and supplies for these 3 agencies, including gloves, masks, covers, gowns for inmates, in the infirmary at the Justice Center, some touchless chest compression units in the fire department, which are pretty cool, I might say. The magic disinfectant ones also for the fire department. Just a large number. Personal protective gear for the police officers. There's quite a bit of detail. I'm more than happy to supply to you because we have to do that as part of the application process. But it's $1.392 million. And the effective date for use of that money is January 1st, 2020 through December 31st, 2021. And spending is underway.
Great. Excellent. Alderwoman Davis.
No questions.
Alderman Vaquero.
I have no questions. I'm more just listening. If something comes up, I'll pop in there.
All right. Alderwoman Hubbard.
No questions.
Alderwoman Ingracia.
No questions.
Alderwoman Murphy.
No questions, thank you.
You're welcome. Alderman Kotar. Alderman Muhammad. Alderman Oldenburg.
No questions. Thank you, Mr. Chairman.
Alderwoman Boyd.
No questions. Thank you, Mr. Chair.
Alderwoman Middlebrook.
I have no questions. Thank you.
Okay. Alderwoman Clark Hubbard.
No questions. Thank you.
All right. And I'll open it up one more time. Any further questions on this subject matter for Ms. Deacon? All right. Alderman, excuse me, Steve Conway, you can move forward with your next section.
All right, we're going to continue with Mr. Matt Moak under the CDA category.
All right. Welcome, Matt.
Thank you, Mr. President. Turning now to the CARES funding for Heat Up, Cool Down St. Louis. You will see on the exhibit there was $1 million in CARES funding for that activity, as well as $2 million in CDBG CV funding for that activity as well. I don't have a lot of detail on this. I have some today, but suffice to say the $1 million in CARES funding has been completely expended. Since July, and I have the numbers for July and August of 2020, there were $375,000 expended, which helped 732 households in the city. For August and September, which is a combo number there. I'm not sure exactly it adds up to $1 million, but I show 891 applicants assisted, $531,104 expended. And then most recently through September 15, there were additional 140 applicants assisted, which represents $93,833 in CARES funding. So as of last week, the $1 million that we had allocated toward this activity have been expended. I'm curious what this committee might think about this, but certainly the original conception of this was the $2 million in CDBG CV for utilities would be something, we don't have it under contract yet. We haven't addressed CDBG at all because of CARES, but it was contemplated as something that could help in utilities in the year 2021 and beyond. Obviously, we have until September of 22 to expend it. Clearly, it's not going to last that long.
No.
But I'm curious, I know that maybe Dr. Eccles would have a comment, but I think we're in a situation here where the demand for funding, of course, is still present. And it's kind of how do we proceed with this $3 million to be the most effective. I mean, right now we're in a situation where the weather is better, but we still have people that are hurting. We get into November, it starts to get cold. I mean, you get the idea. So that's sort of where the effort is on utility assistance. I'll stop there if anybody has questions or comments.
All right.
I'm going to let him do all of his subjects.
Okay.
Okay. All right.
Okay.
All right.
So moving on down, you see we had an administration number of $1,084,059 for CDA administration. This committee will probably recall that normally 20% of any grant award, in this case our grant award was $10,840,586, would be allocated to CDA for administration. That would amount to roughly $2,100,000 in this situation. I'll be frank, there was no way I was doing that. I mean, it's extra demands on our staff, but we reduced that amount in half when we originally passed the board bill through. Since that time, for a reason I'll get into momentarily, I recognized the needs in public services and public facilities was just too great, and I lopped off another $500,000 that would have normally gone to CDA administration and plugged that number into funding some of our public services awards. So along those lines, and I have a couple exhibits I can reference here as time permits, but you see the number under public services, the $2,756,527. That number is just too low. You may recall that I undershot it, frankly, but you may recall back in May, CDA issued an RFP for public services and public facilities and healthcare proposals as well for building healthcare facilities to get that out there, and we solicited responses to assist with preparing for, preventing, or responding to the coronavirus. We received $13 million in proposals. $6.5 million in the public services area and $6.5 million in the public facilities area. No way we could award all that. We came in awarding 40 to 50% of the proposals that we received in this area citywide. While we were reviewing those proposals, of course, this committee in the mayor's office was assessing Dr. Eccles was assessing the other needs in the city. So from CDA's perspective, we needed to merge our RFP and our decisions on those proposals with what other input was coming from this committee and the other decision makers about where we should be spending our money. I think we've done a good job on that. We are still working through the public services and public facilities proposals, meaning we've reviewed them, we've rated them, we've issued award letters in July, but we're still working on putting those entities under contract. I will tell you in that area, we are focused on food access, distribution and outreach, child care, fair housing proposals, health, personal protective equipment and elderly needs, including sanitary needs, homeless prevention, and job training. In addition to that, we solicited proposals to build healthcare facilities or renovate healthcare facilities, particularly on the north side of our city, as we all recognize that this has been a problem up to now. Again, I received $13 million of proposals in this area. I awarded roughly 50% of that, and we moved forward. I don't have entities under contract yet, so I'm not at liberty really to go into that today in terms of who in particular might have been awarded, but suffice to say that I'm working on that. The other thing this committee will recall is in the affordable housing area, you will recall the discussion that we had regarding essentially taking some of the money that's in affordable housing and moving it to the Affordable Housing Commission. We have been in active discussions with April Ford Griffin to do just that. We believe that number will be between $1 million and $1.5 million in amounts that will be essentially programmed to the Affordable Housing Commission to construct or renovate affordable housing.
Okay.
Is there any questions of where we are so far?
We'll open it up for questions when you finish the rest of your.
Okay.
We can have him do the, you can give us an update, Will. Come on over here. Under that category.
Before Matt leaves, if you're moving to someone
He's
else,
not leaving.
we may open it up for questions for Matt if he's suspending his presentation.
That's fine. The last line, Mr. President, is regarding a sobering center for the city of St. Louis, $365,000. And Will Pickney has been intimately involved in that, and he could probably give us an update on that. We're not sure that project's going to go forward. with CARES money, again, that CARES money has to be out the door by 12/31, and we're talking about a construction project where environmental review and the normal federal regulations apply. So it's tough to construct something, but we've been in active discussions with St. Patrick's, and you could expound on that
All
if you
right,
would.
but before we move the wheel, let me open up for some questions for Matt real quick. So Alderwoman Davis, any questions for Matt?
Matt, I just wanted to ask the question. You lost me a little bit when you were talking about utility assistance. Did I hear you say you increased the dollar amount after you saw how much need was there?
No, sorry for having confused you. We had two separate pots of money we were drawing from for utility assistance, one being CARES money, which has been expended, and that's the $1 million number from the exhibit. The other number being $2 million, which I put in my substantial amendment to HUD. That's CDBG money that we will contract with the Department of Health, heat up, cool down to get to them. I think it was confusing, Alderwoman, because originally we contemplated moving the CDBG money into utilities and spending it, say, starting January 2021. It's moving, the million moved, it's gone.
Wow.
And I think the question becomes for us now, when do we want that 2 million to kick in? It's still sitting there, ready to be spent.
Okay, because one of the things I've experienced from talking to people is that there were so many people already in jeopardy when COVID hit. And so decisions need to be made if we're going to pick up the arrears they had before that. And to me, it doesn't make sense not to, because it's not going to go away. And we're trying to put people in a position to move forward. But the other part to that is, and back in the day, I'll just say it like that, when we were dealing with these types of services, we also made referrals for these individuals so that they could go to get job service and other things. And I really want us to work in tandem with agencies that can provide wraparound services, because a lot of these households are simply in trauma mode and they need a lot of different kinds of assistance. So just keep that in mind. And
I understand, Alderman. It's an excellent observation. I do, in the CARES money situation at least, we did do some arrears there with heat up, cool down back to April 1. That's essentially when we started the money. In other words, if you came, we had this ready to go and started paying within a couple weeks of when this board bill became law. We were all about getting on it immediately, and that's what we did. But we did allow people to go back to April 1 on a arrear situation, and we helped a lot of people that way.
All right, thank you.
Alderman Vaquero.
No real questions right now, just listening.
Okay, Alderwoman Hubbard. Alderwoman Hubbard.
No questions.
Alderwoman Ingracia.
Thank you, Mr. President. Matt, can you give the number again, the total households that were helped with the $1 million?
Yes, I can. Sure. There's some overlap in the numbers, and Gentry gave me some not.
Okay, go ahead.
Yeah, so I have, in July and August, I assume this is mainly in July because I have another number for August and September, 732 applicants were assisted, meaning households. In August and September, again, I think there's some overlap in this number, but I have another 891 applicants or households assisted, $531,104 expended. And then most recently, through September 15, an additional 140 households assisted, $93,833 expended, should bring you to 1 million. Okay.
Okay, and that all went to Heat Up St. Louis, correct?
I can't total this too, Alderwoman Ingracia. Looks like.
I'm doing it.
Right, a total of 1,763 households is what we have here. roughly within about 55 days since late July when we began this effort.
Okay, and then the $2 million use, is that also going to go to Heat Up St. Louis? That's still sitting?
Yes.
Okay, and do you know when that's going to happen?
Well, I hope to start
Are
happening
you
in
allowed to
October.
tell me?
Pardon? I missed the last part.
Okay, and are we coordinating with the utility companies in any way? I don't even, are they doing shutoffs, or are they still pushing that out?
Yeah, we are, and I'll let Dr. Eckel speak to that a little bit.
Yes, we're working with them to prevent any individuals from having their utilities cut off. So Heat Up Cool Down St. Louis has working relationships with Ameren and Fire, and both utility companies are also contributing to the cost of the utility bill that we're covering. So Ameren is covering up to 50%, 50 to 75% of some of the bills, and then we're contributing the remaining balance. And then we're working with Fire to get them to increase their contributions to the bill as well.
Okay. Yeah.
Okay, thanks. And then last question, Matt. You talked about the administration fee of that like $1,884,000. Did you say you reduced that amount?
Yes, I did, and by 500,000, and I pushed that 500,000 to my public service awards, public improvements.
Okay, great. Thanks so much.
I haven't
Appreciate your
yet to
time.
contract those, Alderwoman. I've yet to contract those, but that's where it's going.
Thanks again.
Alderwoman Murphy.
No questions, thank you.
Okay. Alderman Coulter.
No questions.
Alderman Muhammad. Alderman Oldenburg. Alderwoman Boyd.
Yes, Mr. President. The question I have for Matt is in reference to Alderwoman, the 19th ward. My brain is dead.
Alderwoman Davis.
Thank you. And Alderwoman Davis comment with the wraparound services. They're more critical now due to COVID, but it's always been I've always felt these services were needed prior to COVID, because I always had an issue, and I don't think, Matt, you all are seeing it, because I spoke at a hearing with Ameren about it. We have people that work that system, and they just go from agency to agency. And I just think the way it's now, we need more so the wraparound service to educate people so they don't have to keep relying on this kind of service to get that help. The seniors that's in a different category, but you have people that's actually doing that for a living. They go from agency to agency. They can tell you when these agencies open up and have these dollars available. But my question is, with the CBDG dollars and the CARE Act dollars, what steps to service social service organizations that's in the communities to help them get those dollars? And is it another round going to come up?
Well, to answer that, our focus with CDBG dollars in the public service areas by category has been, especially with the emergency funds, has been in food access, distribution and outreach, child care, fair housing, PPE and elderly needs, job training, and homeless prevention. Alderwoman, I'm not able to get into the specifics of the contracts right now. I will say, though, of course, the RFP was a very public and transparent process, offering any not-for-profit in the city serving all areas of the city to come forward and make proposals to us, and the response was overwhelming. Of course, we're always happy to see that. We're going to do our best to get those type of monies, services out to the community, while they're also getting potentially utility assistance, and of course, a big topic that we haven't reached yet today, rental or mortgage assistance, which could also be going to that same type of needs, those same households with those type of needs that have been affected by COVID. So I do feel like we are doing a pretty good job with the wraparound idea overall.
So is there gonna be another round?
I'm sorry.
Will there be another round, those dollars?
Well, Alderwoman, and I was going to address what we're doing in Washington, D.C. When we get towards the end, if that's okay with you and Mr. President. Or I can address it now.
We could, if you can address it quickly for the Alderwoman now, that'd be fine.
So a couple of things. Nancy Pelosi has worked on a number of programs. The mayor has signed on a number of letters with the League of Cities and with Nancy Pelosi's group directly as to additional CARES funding. I believe about a month ago we thought actually Congress would do something. Now with the elections, we don't believe that they're doing. We have a lobbyist in Washington, D.C., James Brown, who has worked very, very hard with Senator Blunt and Congressman Clay. We've taken the time and we've gone over all of our needs with Congresswoman-elect Cori Bush. We're comfortable, I say that, but there's an election coming in America. I can't predict perfectly, but we're comfortable that Congress will be in a position at some point in time, whether between now and December 31st or early in January, to continue to provide funds. We can see the other cities across this country suffering, and not just that they're suffering, but their residents are. And we appreciate your efforts so far, everybody on this committee, to help us identify in that first round to get the funds to where we need it. But we do know that these funds are going to run out. Originally, they thought the CARES Act was going to get extended until next year. We know the need is here today anyway, but it has not been extended, and that's still the deadline that we're working with. So we're trying to alleviate as much hardship as we can in the shortest period of time.
Thank you. I'm sorry. Technology and me are not working well today.
Is that it, Alderwoman Boyd?
Yes, sir. Thank you, Mr. President.
All right. Alderwoman Middlebrook.
I have no questions. Thank you, Mr. President.
All right. Alderwoman Clark Hubbard.
No questions. Thank you.
All right. Mr. Conway, you guys are free to move forward.
All right. Under the CDA category, one of the best programs that I think will be really helpful for the city that we're still in discussions with is the Sobering Center, and Will Pinckney is going to talk about that.
So good afternoon. Just really quickly, the city, as you know, had allocated $365,000 for the Sobering Center. The Behavioral Health Network, Wendy Austin, has been leading those conversations around the Sobering Center. We've engaged the governor's office. IKEA made a large financial contribution related to COVID to the governor's office. Due to our efforts around the Sobering Center in the city of St. Louis, the governor's office directed $500,000 of that contribution to the city of St. Louis Sobering Center efforts. The governor's office is also working, and I've had conversations with them as well, with Wendy Austin, to work with DMH and direct DMH to identify some sustainable funding based on the assessment that was done a couple of years ago around triage centers and sobering centers. So the governor's office is really excited about the work that we have been doing and looking to support that. The money that we're looking for now is around operations. The $500,000 that has been directed in the city's money will go towards startup costs. Wendy Austin and BHN are going to be engaging the Regional Health Commission next to identify some money for operational funding from the healthcare systems. And so, as Matt said, the deal is not done yet and it's not concrete yet, but we are feeling really good where we are. Obviously, the decisions will have to be made soon because we are running up in terms of the city's contribution if it goes through CARES Act funds against that December 30th date. So that is where I am right now, or where we are right now in the city, and I'm ready for any questions.
Any questions? Any questions? Let me just go through the list.
I just have one question.
Please proceed, Alderman.
Could you please give us a definition of sobering center, please?
So the sobering center is a location where people who are intoxicated through alcohol or substances can go to be stabilized, to sober up under medical observation. We are looking at a more enhanced model of that sobering center, which will potentially have the ability to connect people to treatment and offer some substance use services. And so that's what a sobering center is. I hope I answered your question, Alderman.
What is the time frame that they'll be allowed to be there?
The average stay in sobering centers around the country is between 4 and 8 hours. So it's a short-term stay. It is a diversion location. So instead of people being picked up by police and taken to jail or to a hospital, this is where people are able to be diverted.
Okay. So the staff that's there and their connection to resources has to be at the highest level. And so all that structure you guys have already put in place.
Yes, so remember we have substance use and behavioral health providers in the city already providing many of these services, and they have been part of the discussion. So they would be in some of them would be co-located in this in the sobering center.
Okay. Thank you.
You're welcome.
Alderman Vaquero, any questions?
Well, no, I think I'm gonna leave it at, well, I guess I'm a little curious on them sobering centers. How are we getting that out to the public? I mean, I think it's the first I'm hearing of it, but how are we getting it out so people know they could refer people or something? It's not a question.
So it's not currently, Alderman Vaquero is not currently open and operating, but this would be, the people would be able to be diverted to this location by police, by EMS, and in the enhanced model, there would be in fact a van of behavioral health professionals that would be able to go out and bring people to the location. And we would put out communications that this is obviously something that's available.
Yeah, girl, tell me I'm doing 3 things at one time.
Okay, I'm done. Thank you.
Okay. Alderwoman Hubbard.
Thank you, Mr. President. Where is, I'm sorry, I was multitasking, so I may have missed something. Where is this sobering center located, or where is it scheduled to be located, or?
So we had one location in mind, but that isn't going to work out, and so we are currently looking at another location or other locations. So we don't, the location hasn't been confirmed at this point.
Okay, can you tell me what the possible location is, or have who's ever ward it's in, have you all been in communication with them regarding that?
No, we haven't. It hasn't been a decision made, so we haven't been in contact with them. We're just looking for possible locations.
Okay, I think it would be good, out of respect for whomever's ward it lands in. I think it would be good to have them involved in that communication early on, because when you don't, then it may be met with resistance from the neighbors, and it kind of puts the sitting alderperson in an awkward space. So before we get out there too far on that, I think it would be in all of our best interest to properly vet that with the community prior to doing so. And that's all I have. Thank you.
All right,
no problem.
Thank you. Alderwoman Ingracia.
Thank you, Mr. President. Will, you mentioned that the state gave the city $500,000 and the city put in $500,000. Is that accurate?
Well, just one correction. It is, the money wouldn't go to the city. It would go towards a sobering effort. But yes, the state has dedicated $500,000 and the city has dedicated $365,000.
Okay, so the $368,000, you're going to be able to use that before the end of the year?
Yes, that is the plan. As I said, we obviously, decisions need to be made really quickly, so the Behavioral Health Network is engaged in the RHC, and we're hoping to find out in short order if those operational funds will be identified, because without the operational funds, obviously the project can't go forward.
What's the total cost of the startup cost for the project?
So the startup cost is the 865,000 does cover the startup cost, so that is the startup cost. The operational cost for the enhanced model is about $1.5 million.
Okay, and if you don't mind, could I back up? I meant to ask on the heat up, cool down St. Louis, is there an age restriction, Matt, on who is allowed to apply for those funds?
Yeah, I'm not aware of that. Do you know?
Not aware of that, but we work with the utility companies to validate the information that's provided. So there isn't an age.
Okay, if somebody could get me confirmation on that,
Valerie's saying no. Valerie's shaking her head no, sorry. Yeah, Valerie Russell, the Director of Human Services, saying there is no age restriction.
there is none, I'm sorry.
Yes, there is none. I'm sorry with the math. There is no age restriction.
Well, when you say age restriction, do you mean how old the debt is or how old the debt holder is?
Okay.
Thanks for clearing that up, the debt holder.
Yeah, the debt holder, we don't know of any age restriction. But in Missouri, you got to be 18 to contract, so that would normally be a case.
But there's a validation process that occurs. So whenever we receive a request or application for utility assistance, we work with Ameren and Spire to make sure that the bill is actually in their system. And so we go into their system, or Heat Up Cool Down St. Louis goes into their system, validates the information, and works with them to verify the information that's provided. So there are balances and checkpoints in place to make sure that the applications are actually valid.
I was just curious because I looked up their application and the date of birth is a requirement to apply. So that just made me wonder if they had age restrictions. Thank you for clearing that up.
Thank you. Alderwoman Murphy.
No questions, thank you.
All right, Alderman Kodar.
No questions.
Alderman Muhammad. Alderman Oldenburg.
No questions. Thank you, Mr.
Alderwoman Boyd.
No questions, Mr. President.
All right, Alderwoman Middlebrook.
Thank you. I have no questions.
Alderwoman Clark Hubbard.
No questions. Thank you.
All right, Mr. Conway, please proceed.
All right. And we have Valerie Russell with us to go over to this, her department and the status of all of her efforts to date. And she is going to start as soon as she gets seated.
Good morning.
Good morning.
Good morning. I wanted to go over the various sources of funds that we received and the status of the use of those funds. I'm going to start with the emergency shelter grant funds. On your spreadsheet, you will see that we committed to provide dollars for rapid rehousing, emergency shelter, street outreach for homeless management information system, and Department of Human Services admin cost. Those grants are all HUD dollars, and we just recently received through CDA the grant agreements for those dollars. Prior to receiving the grant agreement, none of the funds could be utilized. However, we have released an RFP, received the responses to that RFP. The PSA committee has met, gone over and reviewed every proposal. We had approximately $5.4 million. We received proposals, requests over $10 million. So those proposals now are at a state of the Department of Human Services negotiating with subcontractors who were determined to be eligible on the basis of the content of their proposals to determine exactly the services that they would be providing and if those are the best use of the funds. We anticipate going into contract negotiations with approximately, I would say 12 organizations. The negotiations range from working down their budgets. They all ask for more than we have available, as well as making certain that services that are actually needed can be provided. And I'll give you an example. Under street outreach, we had hoped to secure services for individuals who would be willing to go out into the community, go into encampments and other locations where people are found sleeping. We did not receive the level of proposals that we had hoped for that activity. So we will be awarding to those who said they would and negotiating on the content of their activities to make sure that they're not just doing what they used to do, but that they are in fact adding value to the activities. Those dollars for those categories that have not been determined to award yet, we will be releasing additional RFPs to secure the kind of services that we know are needed in the area. In addition, one of the major things that we hope to and we know that we need is the rapid rehousing for homeless individuals. We have, with CARES Act dollars and FEMA dollars, housed a great number of homeless individuals that eventually will have to move on. So we are hoping to make certain that we have dollars in that category to move some of those individuals into transitional or permanent housing according to the HUD regulations. And I say that because we can't just move someone if they're not eligible. I'm going to move to the CARES Act funds, the rental and mortgage assistance. We have secured contracts with 14 different agencies who are located throughout the metropolitan St. Louis area, St. Louis City area, to enter into negotiations with landlords to obtain the paperwork that's necessary according to the federal government to make these funds such that we have the documentation to support the expenditures. If you have any questions about who those agencies are, I can certainly answer those questions after this presentation. On your budget, you see we had $5.4 million identified for rental and mortgage assistance. We have allocated and encumbered $5.355 million of those, and basically had $45,000 left that we'll be using very, very shortly to amend contracts of organizations so that we can add more dollars. Under homeless prevention and program operation, we identified $1.5 million, and we have awarded $1.33 for that particular activity. I will note that just as COVID has affected the general population, our subcontractors are equally being impacted. They had to secure new staff in order to add this as a new program within their agency. And so there's been a slow start to the review of applications, et cetera. As of 9/21/20, last Friday, $544,729.44 has been distributed to landlords and or mortgage lenders for that particular effort.
308.
There are 308 individual households who have been assisted so far. We received and are still receiving over 6,500 applications from individuals in the city of St. Louis who indicate that they want rental and mortgage assistance. I will have to say, because I'm sure it's on all of your minds, that receipt of an application does not immediately mean that person is eligible. The federal government required under this fund that it had to have a COVID impact, and that's what made them eligible. And the coronavirus was declared in March of 2020. So the applications that are being reviewed are for arrears that started at March moving forward. We could not cover the arrears of individuals that had accumulated prior to March. So it takes quite some time to go through these applications, to work out the logistics, to get information from landlords. They are not all complying, to get the type of paperwork that we need to support the expenditures, but we're moving forward. All 14 of those subcontractors are moving diligently. We have entered into contracts for eviction mediation. We find that the landlords actually are negotiating and preferring that process to going to court. So we hope to be able to have some very successful outcomes from that service. The legal services that the Board of Aldermen asked that we add, those have been handled very efficiently. We have 2 subcontractors providing legal services to individuals who are and have court dates related to evictions to negotiate with the landlords. Housing locators and landlord engagement. We have 2 particular activities going on right now, and we'll be working with others to secure more services under that category. We're in the process of amending contracts to add more money for those services. The protective equipment for DHS subcontractors, requests have been made to the shelters on what's going to make their facility appropriate when they start adding back in the level of population that they had prior to COVID. They have all reduced their populations since the COVID pandemic. We are asking them, what is it that they need? What can we help you with to make sure that your facility is safe? We are negotiating with them in this regard, looking at prototypes, and we will be funding the development of those things. The family court continues to monitor the eviction docket and screen for applications that are eligible for CARES Act dollars, and I'm adding that in, although I've gone through the rental and mortgage assistance. This is an important point. We have applications coming from individuals who may have an eviction and may not be in court. So the family court division has lended their staff to go through the eviction docket. They are providing the rental and mortgage assistance application to individuals on that docket so that they can submit that for assistance consideration. And that process is going very well. Moving down to the rapid rehousing and additional shelter bed expansion, that goes back to making certain that we have adequate number, and I can't even say adequate. There are more homeless individuals than we have beds. However, we are working with and requesting information from the shelters on what kind of construction, expansions, or renovations that they can add to their facility that we will fund from these dollars to get more people into the shelters. Those negotiations are in play at this time. United Way 211 Homeless Prevention Housing Assessment. Without the United Way's assistance and capturing the data, the question that one of the alderpersons asked about making sure we weren't duplicating, how do we know that someone's not trying to scam us? The United Way's database is inputting every application, every name of a person who has applied for funds. When those names are provided through referral to all 14 of our subcontractors, they then enter in the fact that they are going to be making contact with that person so that no other provider then has that name. This is the way where we are going to ensure that we don't have duplication and that information is available through reports from the United Way to our offices and to the mayor's office. In addition, they are doing applications by phone. They are receiving applications via the internet, reviewing those to make sure that all the information is there and that the person's eligible via their city residency before they forward those on to the subcontractors. The emergency shelter locations and management have 2 different sources of funds, one the CARES Act and the other for FEMA, and we gather the information from all of the different shelter locations that we have operating, special housing locations in particular, as well as the food and the transportation and the security needed at those different facilities so that we have homeless individuals off the street and we reduce their exposure to COVID-19. We have received notification from FEMA that they will discontinue their payment as of 12/31/20. So we are working diligently to try to identify more shelter beds, and that's why you see those requests being sent to shelters to help us in that effort. If there are any other questions, I'm available to answer your questions.
All right, Alderwoman Davis.
I don't, I think the only question I had was when you talked about receiving, I think it was like 6,000 applications or something to your office. Is your office actually trying to provide the service, or are you sending? Oh, great. Okay. I was trying to figure that out.
And in fact, our office does not receive the applications. They go onto a portal online. If a person does not have the ability to access the internet, that's when our office gets involved. We mail the application to them. We receive the application back by mail, and we forward that to staff who then input that information into the database so that that referral can be sent to an agency.
That's very good. I just want to thank you for all the detailed information. That's it for me, sir.
All right, Alderman Vaquero.
Comment as much as a question, but yes. So we have more homeless people than we have beds, but yet we're still not willing to negotiate or work with Larry Rice, who has been trying to open a place that could provide. I guess my concern is we're happy to fall. It's fall today, summer's over. The next step is winter, at least on my calendar. So are we gonna wait until we got people freezing and say, gee, you know what, we still have to space out the beds because we can't have as many people in the shelter because of COVID. So are we gonna leave people out on the street? Or, you know, I know you say you're reaching out. Have we reached out to Larry Rice and worked out something with him to limit the amount of people there? I see Alderman Davis is saying, shaking her head no, but I'm not asking her, I'm asking.
Alderman, I can tell you we've added 275 beds since we started this process between the City of Hope, the Little Sisters of the Poor, the Western. We continue to plan to add additional beds because we know that this crisis will continue to grow. We've gone back, if you look at that sheet, we've gone back to the shelters that had cut their capacity in half, and we are working with the COC to get them to increase their shelter. We're also working with the Winter Outreach Group to make sure that they're up and running this winter. And then we have one or two other items that we're working to add at least another 50 beds by December 1st.
Okay, but Steve,
so we're putting 325 new beds on the rolls.
But that doesn't seem to be even enough. According to what she was saying, you're short way more than that. And if she wants to tell me this 350 beds cover all the homeless people that we have to shelter, I don't believe so from the conversation.
I agree with you that there are not currently enough beds to house all of the homeless.
Okay, but not currently. I'm talking about, let's just say the mayor's office and Steve finds the 350 more beds by December 1st if nobody dies in the street during November. Is that going to be enough to cover it?
So
It's a simple
I'm going
yes or no.
to approach your question in two ways. The CARES Act funds can only be spent through December 31st. What we are planning is what happens and what funds we can put toward winter outreach and winter overflow sheltering from January moving forward. In that ESG dollars that I discussed earlier, That's where we are trying to make sure that we have funds identified to increase the number of beds. And we are in negotiations with various locations in order to do that.
But
I will say that we're hampered, however, by the fact that just as there are businesses who have had to reduce their patrons because of COVID-19, we have volunteer shelters who in prior years may have operated and provided beds. They're leery to do so now for social distancing reasons. So the negotiations that we're going through involve discussions we've not had to have before.
So I'm just looking for a simple yes or no.
If
If we're able to find that 350 extra beds, does that cover all the homeless people?
It does not, but New Life
Does
Center
not. Well,
did not
that's what I
apply
wanted
for
to
the
know.
funds.
So,
New Life Center did not apply for the funds, Alderman Vaccaro, and those RFPs were available. We are going to be releasing additional RFPs. They are available and welcome to apply.
when you say they are welcome to apply, who are they?
The New Life Center, sir. They can apply for the funds.
But their building is still where they're saying, gee, you know what, they have to do this. And, you know, I guess my concern is still the homeless people. That you know, how many realistically, not 350, but how many beds realistically do we have to come up with?
If I could do a calculation and provide that to the Board of Aldermen in very short order, but not on this phone call. We are negotiating, as I said, on the number of beds that these facilities are willing to provide. And I cannot give you an exact number at this moment. However, we will get back with you.
Have we reached out to the county to see what they have going on? Are they going to cooperate? You know,
Yeah, Alderman, we've reached out to the county once or twice. We actually even forwarded all of our rental and mortgage assistance applications that were from county residents to them. I would say the other thing is on the overflow beds, we would like the county to do more because a very large number of the homeless population here in the city come from St. Louis County just because the services are here.
I don't disagree with that. Well, I guess I'm just concerned, and I wanted to voice my opinion now. You know, it just seems to me that, you know, and it's not in my, you know, New Life is not in my ward. I get that. But I do have a concern that if people start dying, freezing, we're going to have a whole new problem on our hands and a whole new reason for people to protest. And, you know, and I just think we got 8 weeks to be ahead of the curve on this. So I'm just throwing it out there. I just wanted to be on record as throwing it out there. So,
well, unfortunately, the mayor doesn't get to throw that out there. She's taken responsibility. She has her administration working on all of these and additional alternatives because she can't throw it out there. She's responsible.
So then, Steve, I'm going to ask you then flat out. Is she negotiating with New Life? I mean, you're saying—
New Life is not on the agenda. They have not applied for anything.
Has she tried to, anybody in your office tried to get a hold of them? I mean, when you say the mayor doesn't have the mayor doesn't have the ability to throw something out there, I'm fine with that. I guess if I was mayor, I would try to be looking at every avenue. I wouldn't say, well, if somebody calls me, I'll look at that. Steve, I'm not here to embarrass the mayor or do anything.
We're not embarrassed by our efforts, Alderman. The mayor, we reach out to Continuum of Care, which is a large organization of people. They all get the request and the data for the request for proposals. These are proven providers that many of you all know are spread throughout the city of St. Louis. The New Life Evangelistic Center has the opportunity to bid on any of the projects. I cannot, address the building code violations at that building, but as a provider, they can address and do some of the programs that we're advertising for people to do, either manage, solicit, feed, provide casework services. There's so many programs that we are asking providers to step forward on.
I will have them give you a call. Steve, I'm going to cut it short only because we got public safety at 1 o'clock. And we could argue this all day. So I will ask them to get a hold of you guys.
Okay.
But thank you.
Thank you. Alderwoman Hubbard.
Thank you, Mr. President, members of the committee. Thank you, Alderman Vaquero, for sharing so much care and concern about NLEC in the 5th Ward, but I'll go on record and say that they haven't contacted me regarding anything. And so I don't know what those conversations are, but I think it's in all of our best interest to prepare ourselves for the future and what may happen this winter in regards to our homeless population. So that's all I have. Thank you.
All right. Alderwoman Murphy. Excuse me, Alderwoman Ingracia.
Thank you, Mr. President. Hi, Valerie. Just a handful of questions for you. On the rental and mortgage assistance, I just want to make sure I heard the number correct, that about 5.3 million has been allocated. Is that amount money that has actually left the city to the 14 agencies you identified?
Did they get the checks?
Yes, the funds were submitted or provided to all of the 14 agencies in advance, so they did not have to float these dollars and could get the funds out quickly.
Okay, do you know when did they all receive checks about the same time? I'm curious about when that was.
Every agency that we gave a contract to received their checks within a week of one another. We did all of the checks through the comptroller's office. We provided all the documentation that the comptroller's office requires for those and did the advance checks request. And yes, they have received their funds, all of them.
Okay, and then what does the process look like? Well, not necessarily the process. What is the ETA on the residents themselves receiving relief through their landlords or through the checks going to landlords?
The process for landlords obtaining their checks is based upon going through those 6,000 applications, first come, first serve, and working with those who have evictions in court already. So those agencies are going through to make contact. It's difficult to get in contact with a lot of these individuals, and it's been difficult for them to secure the information from landlords. Some will not even provide leases. So this negotiation is far-reaching and more labor-intensive than I think even our providers anticipated. The period of time that it takes to get that application, get the documents, I would say less than a week. Once they get the information that they need, they can get a check out.
Okay.
So, Alderwoman, basically what my providers are doing, the 14 providers are doing, they're taking the applications, they're making the calls, the emails to the tenants that made the application to get their information that we're required by law to have so that we can pay out the monies. Once they get that, if they come in, they actually make an appointment. Many of these people that are applying for it have missed 1, 2, and 3 appointments. And we're spending a lot of time for basically people that aren't showing. But it basically takes 2 to 3 weeks to get their documentation. Then we turn around and go back to the landlord to make sure that we got the documentation, that everything's legitimate, and then we write a check. And what my service providers are telling me here now that they're up and running and they have a lot of applications in the program. They've got hundreds and hundreds in varying stages of approval. And they'll continue to accelerate as that time builds up. So we're very comfortable that they will spend the funds. But some of our larger providers are telling me 20 to 25% of the applications were ineligible because it was for monies owed before March 1st. That will start to diminish as they go forward. Another provider, one of the largest here in the city, are saying 40 to 50% of these applications as of this time have been unable to provide that it was due to COVID-19, are not providing any financial hardship information. So we've encouraged them then to go ahead and move on and get through the applications as fast as possible. They've all received their funding, and they've received separate funding for the administration of the program.
Got it. Thank you. And then I guess I'm a little concerned that we are basing the beds that we need via negotiation with the COC and winter outreach. I guess I would argue that we need to figure out how many beds we need total and then work backwards from there. I mean, regardless of what the service providers are able to take on at this point in time, the city still has an obligation to our unhoused neighbors, regardless of the capacity of third-party contractors. So is the city working on a strategy, with respect to what happens if the providers aren't able to deliver the level of services we know our community needs?
So two things. One is if I don't know what I can provide, if I don't know what the COC can provide, I don't really know if I say I need 1,000 beds, which if they're going to provide 300, then I only need 700. If they're going to provide 800, I only need 200. So it is a relevant factor in making that determination. The one thing that we can't predict, because we don't have an exact crystal ball, is how bad the economy will be on future people during the next 30, 60, 90 days. If I had that, it would make it even easier for me to continue to secure additional space. But we'll continue to consider to access additional space because we all know that it is. And we're comfortable that as long as we still have money, we will be providing that service.
Okay, and then are the hotels, I guess, I don't remember if there are 3 or 4 left, are those going to be continuing in operation to the end of the year? And then if contracts are not extended, what is the plan for folks who are currently in temporary shelters using CARES Act money?
There are only 2 hotels that are operating, and those contracts are being extended through December 31st, which is when the CARES Act funds have to be utilized. We are negotiating with some other facilities. That's why I mentioned the fact that we are in conversation with the shelters, because we don't know what funds other than ESG might be available. And under ESG, only a percentage of those funds can be used for emergency shelter.
Okay, and how many people are currently in the hotels?
The exact number of the individuals in the hotels currently is about 259.
Okay.
And I'm going to clarify that there are only 2 hotels, but there are other types of facilities that are being utilized. One is a nursing home that has opened up several floors that were not in use. That's not considered a hotel.
Yeah, thanks for clarifying that. I should have just called them temporary shelters. Appreciate your time, Valerie.
All right, anything further, Alderwoman?
No, thank you, Mr. President.
You're welcome. Alderwoman Murphy.
Yeah, I guess just a comment concerning about our ability to house the homeless. I said Steve brought this up a little bit, that where are our surrounding communities, or how are our surrounding communities stepping up to the plate for the homeless? As we know, many of those people are not city folks. We've had instances where they've literally just dropped them in the city. And so I said, my concern is like, what does U City do about the homeless? What does any of our surrounding areas do about the homeless? He touched on St. Louis County in one way. And I just wanted to perhaps bring up that when the protesting starts, that perhaps they're picketing in the wrong place. Our community, meaning the St. Louis City, seems to be doing the very best it can to take care of everyone. And so perhaps when the protesting starts, the picketers need to be in some other communities and asking where their services are. Thank you, that's all.
All right, thank you, Alderwoman. Alderman Coder.
For Valerie, on the numbers you just gave for folks in I guess hotels or the nursing home and temporary shelter, was that 250 something? Was that just in the hotels or was that in all of our temporary shelter space?
Or added on.
Those are in all of the temporary shelters, and we are adding additional beds. There are some churches that have opened up their doors for walk-up sheltering. They don't provide any other service than shelter, the nursing home, the 2 hotels, etc.
Got it. Thank you. And Valerie, thank you for all your help. You've been wonderful. I know this is a very challenging job and time, and I appreciate all of you and your team's efforts.
Thank you.
All right, thank you. Alderman Muhammad. Alderman Oldenburg. Alderman Boyd. Alderwoman Boyd.
No questions. Thank you, Mr.
All right,
President.
Alderwoman Middlebrook.
No questions, Mr. President. Thank you.
All right, Alderwoman Clark Hubbard.
No questions. Thank you.
All right. Mr. Conway, please proceed.
All right, Mr. President, it was good that we had an opportunity to hear the questions so that we can come back and where applicable, get some racial and gender data on our numbers the next time. I will tell you with respect to the homeless outreach, the rental and mortgage assistance, we are the only community in the region that is doing the active rental and mortgage assistance right now. And good for us because these 14 providers that are out there, we have them under contract. And that means they have to take care of us. If the county or St. Charles or Franklin or Jefferson want to get in line, they got to get in line after us. So I feel really, really comfortable. We are doing the absolute best that we can with the limited funds that we have. We've made a case to the state of Missouri that St. Louis County got $153 per person. We only got about $108 per person from the state of Missouri. It is our position that the state of Missouri owes us $17 million in CARES fund. We've provided them the documentation. We've gone to Washington, D.C. with some of these issues because why should the St. Louis County get more per person than the St. Louis City when our needs are greater? And that's why we have to be so careful of how we spend these funds. And that's why we try to leverage these COVID or the CARES Act funds with the other programs, FEMA and the ESG and the CDBG, so we could get the most leverage to help the most people in the city of St. Louis. So next month, we will give you, where applicable, some of the data that you'd like to see, and we'll give that to you in advance. The one other thing I can tell you is we will, I think we've asked Alderwoman Murphy to do another board bill for us. We just got notification 7 or 8 days ago that we got a final residual amount of about $2.3 million in CDBG money exclusively for rental and mortgage assistance. And the nice thing is, since it's CDBG money, we don't have to spend it before the end of the year. We can put it on the back end so that we can continue this program going into 2021 and keep our fingers crossed that Congress or the new president or somebody makes this a priority to address the human needs throughout this nation.
All right, thank you. Thank you, Mr. Conway. With that, I'll entertain a motion to adjourn this COVID-19 special committee.
So moved.
Oh, yeah, I'll say, I'll
Moved
second
by
that.
Alderman from the 6th, seconded by Alderman from the 23rd, that we adjourn today's meeting. All in favor signify by saying aye.
Aye.
Opposed, motion carries. Thank you all for all of your time, and thank you to the Mayor's office for the presentation. Thank you.
Thank you.